Welcome from the side of Bemax Academy. My name is Bibin Prasannan, your friend, collaborator in this Q&A discussion for physiotherapy licensed exam training. As a part of Bemax initiative, we have this program where we come together every week to give you unique perspectives regarding small topics in physiotherapy, which would be very useful for the way ahead in your licensed exam. As you know, the preparation to licensure exam is is not clearly defined anywhere. For different type of licensure exam models, we have different strategies, and it is very important to prioritize your time and at the same time focus on what to learn properly. And at BMAX, our main aim is to guide you towards correct resources with correct timing. So let me introduce you or welcome you to our new small topic discussion. We are just going to explore the wide field of concepts of muscle structure and function, or muscle strength and function. Whenever we discuss the term strength, what comes in our mind is a ability of a muscle to hold on to something that is heavy, in simple terms. So basically, it is a force output of a muscle, which can be clearly demonstrated in a certain manner. So, whenever a person is lifting a 2 kg weight or a 5 kg weight, or if a person is pushing onto a heavy object, we are demonstrating nothing but strength of the muscle. So, strength is the force output of a contracting muscle. And we know that this contracting muscle will always have a slight amount of tension. So, the force output of a contracting muscle, which is directly related to its tension, can be in simpler terms called as strength. When we discuss about the contractile elements of muscle, we know that when we explore the whole muscle structure, the muscle fibers are composed of individual substances called as myofibrils. These myofibrils, they contain sarcomeres. So these sarcomeres are basically considered as the unit of contractile element. So sarcomeres are basic contractile unit, and they are formed by actin-myosin cross bridges. This actin-myosin cross bridges is significant because whenever we are doing a muscle contraction, this actin-myosin clubs together as a link, and this provides the anchorage for the muscle tension. So this actin-myosin cross bridges are at its maximum congruency when a muscle is at a fully contracted position. When we are flexing the knee joint, the actin-myosin units of the hamstring muscle group is at the fullest, and at the same time, the quadriceps muscle group, they are stretched. Same way, when we consider the muscle contractile action, for every concentric action, like every contracting action, there is a relaxing action opposite side. There is an eccentric action that is happening at the antagonist side of the muscle. So during muscle contraction, the actin-myosin comes together and form a cross bridge, which is very strongest. And during relaxation, there is a disengagement of this cross bridge. So basically, this actin and myosin, they disengage, or the tension that is created during a contraction slowly relaxes. This small concept is very important. Imagine a person is immobilized for a longer period of time. We believe that whenever immobilization is done after an injury, it's obviously done at the mid-range of the joint. So there are so many factors biomechanically for this thing, because uh, if you immobilize the joint at the extreme of the range, there are greater chances that the musculotendinous shortening adaptation is more, and at the opposite side, as it is stretched, it may go for weakness. So always we prefer for a mid-range uh, because it gives advantage at the both direction, because the tissues are neither too contracted at that point or too relaxed. So the muscles basically consist of three types of fibers. There are type 1, type 2A, and type 2B. The type 1 muscles, they are called as slow twitch muscles. So these slow twitch muscles, they have a particular characteristics. As the name suggests, they are slow. They are slow in contraction speed and they have low force production. And most important factor, they have high fatigue resistance. So the way we train uh, type 1 fiber is entirely different from type 2. So it is always uh, advisable to train type 1A muscle fiber, low load weight for a longer duration of time because based on its biomechanical characteristics, they have a slow contraction speed, low force production, and high fatigue resistant. And type 2A, they are fast twitch muscle fibers, but we can categorize them as some sort of a muscle that forms a partition between type 1 and type 2B. Type 2A, they have a fast contraction speed, they have a moderate force production and moderate fatigue resistance. So we can call the type 2A muscle as some sort of a muscle that stands in between type 1 and type 2B. Type 2B is fast twitch muscles. It has a high contraction speed, high force production, but quick fatigue. So when we take a simple example of running, the two key types of runners, endurance or the marathon runners or the force production sprint runners. For a sprint running and marathon running, like for a marathon runner, sometimes it's believed that the type 1 fiber is predominant because they are more of high fatigue resistant and low force production. For a sprinter, we need the high force producing muscle to be active during the short bout. So for a sprinter, for a 100-meter sprint or some sort of activities like that, we need predominant force. So the type 2B activity may predominate there. Even though we discussed all these factors, there are some hereditary factors also that comes into play. Even though the human body muscle pattern is schema is influenced by heredity, it can be greatly influenced by the nature of the training also. Like a body where a type 1 uh, is predominant can be influenced to such a way that the type 1 composition decreases and type 2B or type 2A increases based on the nature of training. So that's one aspect regarding the fiber types and hereditary influences. And there is a recruitment order. A recruitment order is a sequence of motor unit activation. Imagine that we told about the slow twitch, fast twitch fibers, type 1A, type 2A, type 2B. A person is lifting a 1 kg dumbbell and a person is lifting 12 kg or 15 kg or even 10 kg dumbbell. We know that the amount of effort used is more when a person is lifting 10 kg compared to a person is lifting 1 kg. How exactly this happens in our human body? There is a mechanism by which our motor units are synchronized with the signals that we get from the muscles. This is somewhat called as a recruitment order. So always uh, our musculotendinous unit gauges the amount of tension produced in the muscle, and the feedbacks are sent to our higher centers, which in turn gives the signal back to the muscles. So size principle basically believes in the fact that the motor units doesn't need to be recruited randomly. So based on the amount of force that we are generating, the motor units gets added on. For example, if it is for a slow weight or a low load, the lower motor units or the lower uh, fibers will get activated first. For a low load, we know that the type 1 fibers are predominant, which are fatigue resistant, low force contracting capacity. So as the load increases, the type 2A and type 2 fibers are being added onto the pool. So there is a sequence based on the activity and intensity. Always the slow twitch fibers are activated first, followed by fast twitch 2A and then fast twitch 2B. So this is the sequence that we need to remember for any motor unit recruitment activity. And this is a mechanism of our human body to make sure that the efforts that we use or the efforts that we put in are not wasted or it's used properly. So slow twitch fibers for low intensity and fast twitch fibers for high intensity activity. Length tension relationship. There's a point where the muscle is at maximum tension and it is usually at the mid range of movement. For biceps curl example, if you want to get the optimum tension of the biceps, uh, that is at the mid range. So at the same point, the triceps is also tensed. So this mid range is always very important because it helps in developing some sort of a co-contracting capacity between the agonist and antagonist, which is key for stability training. So in stability training, even though we follow the traditional perturbation and the strength training aspects to enhance the neuromuscular mechanism, it is also key that we have to develop the co-contracting mechanism of the agonist and antagonist. This co-contracting mechanism is greatly developed when we tell the person to do a pose or hold at particular joint positions. So to maintain a joint position, we need the both agonist and antagonist acting synchronous manner to maintain the stability. So maximum tension development is at the mid range and weakest point is at the end ranges. When a muscle is at a fully contracted phase or fully relaxed phase, it limits the amount of tension that can be generated. So that's the weakest point. And the musculotendinous unit, whenever we apply a load on it for a longer period of time, they have a ability to get stretched. We name it as elasticity, and once the stretch force is removed, they have a tendency to come back to the resting uh, length. But there are what to say exceptions in this. When we dive deep into the biomechanical aspect, we know that every tissue has a particular amount of creep, elastic zone and a plastic zone. So once we breach the elastic limit, then we go to the plastic zone where the stretch deformation that is happening is permanent. So that's a point of discussion for some other day. So let's move on to our topic. The key adaptations that commonly occur with the strength training are numerous. To name some of them, it's very important to understand the basic muscle structure and function and how we are uh, gauging the effects of our training. But there are some specific parameters that helps us to detect whether our training session is beneficial. So we know that whenever a person is indulging in a hypertrophy training, if it's in a structured format, in 6 to 8 months, he can see visible differences in the muscle hypertrophy pattern. Remodeling, uh, as I said, like if a muscle has to get hypertrophy, it can happen by different ways. Either the size of the individual muscle fibers can increase, or the number of muscle fibers can increase, or the motor unit coordination power can also improve. So there are different ways by which the remodeling can occur. We discussed about the size principle. We told that there is a recruitment order where we start with the type 1A fiber, then fast twitch 2A and fast twitch 2B. So this is called as a motor recruitment strategy or synchronization. So as the load is increased, the more and more motor units are added to the pool. So first it will start with the small muscle fiber, and based on the loads, this muscle fiber keeps accumulating or they keep adding up, so, which is in turn in simple terms called a size principle of motor unit recruitment. As we know, if we are not training in a proper manner, if we are not doing the correct regimen properly, in 2 to 3 weeks, if a person is stopping training, he will go for deconditioning. So the muscle memory is there. The muscle will readjust itself that load is not falling on me. So I have to reduce my bulk. So there is a disease atrophy that usually happens due to muscle inactivity. So it's always advisable that if a person is getting indulged in strength training or any other activity, we need to follow a minimum of 3 to 4 days per week. So it's always as a count of measure. It's believed that we should not take more than 2 days of inactivity while training. The positive functional improvements that we can find is there is change in the muscle strength, there is change in muscle mass, there is improved body composition. Obviously, this improved body composition rather than looking it purely into an aesthetic manner. It's time that we as professionals, or uh, we as a sedentary individuals, if you are a sedentary individual, you need to look into ways by which how this exercise can change the outlook of your body, outlook of your mind, and outlook of the way you are performing in your daily stream of life. So that is very vital aspect of that. So there is enhanced metabolism, improved cardiovascular health also. So we know that weight training, improved weight control is one aspect of it. So I need to put one factor here, that there is a predominant belief that cardiovascular exercise is a predominant form of weight loss, but along with cardiovascular exercise, strength training is also essential. So imagine we discussed about benefits of strength training, where the muscle fibers may increase or muscle fibers may get remodeled. So this increased muscle fiber will always help you in burning your calories in a more efficient manner. So always a judicious mixture of strength training plus your traditional cardiac training, or whether it is high intensity interval training. High intensity interval training at later ages is always recommended after cardiac stress testing, and also always go for a scientific method before you are getting indulged in a high intensity activity. So if you are an athlete, it will improve your athletic performance, and it helps you in performing your ADL activities or activities of daily living in a better manner, and obviously, as I told, better posture and self-image. So what determines the strength that we are developing in our body? There is something called as an overload principle. Or what overload principle says that you need to lift slightly above your present limit. So in exercise therapy, we have a concept of 1 RM, the maximum amount of weight that a person can lift without any break in his form, to be precise. The maximum amount of weight that a person can lift in a single attempt. So along with that definition, we need to add that the person should not be doing any trick movements. For example, imagine that a person is doing a biceps curl. He's doing biceps curl like this, and he's able to do a 1 RM with this way. He's leaning back and then lifting. Would you consider that as a 1 RM? Because in this fancy YouTube world, we see a lot of videos where the so-called influencers are promoting this aspect, lifting the biceps curl like this. So biomechanically, if you consider, imagine the weight of the load that is on your biceps, and where it is getting translated is in your posterior chain, your posterior lumbar spinal elements. So in case of a lack of control, your whole body is going to compensate for that. So always prefer that weight which a person can lift without a break in his form. That is key here. So the load should be slightly above the current capacity, and this current capacity needs to be evaluated periodically, say 1.5 to 3 months, to make sure that the your body or your motor units are not getting accommodated to the load, or at the same time they are getting challenged to the new ways, and you are not letting the brain catch the stimulus pattern in such a way that after a certain period of time the progress is plateaued. Specificity: you obviously won't train a marathon runner or an endurance or a sprint runner or a boxer or cricketer in the same manner. So you know that for a boxer, he may need this sudden spurt of activity. He may need a core strength and dynamic activity of the upper chain, his chest muscles, his deltoid muscles, the sometimes the extension activity that he is generating through his punch, his core contraction power at different range of movement. All these things are very important. So train based on the specificity. I'm not going to dive deep into all these aspects, because that itself is a vast topic. Reversibility, in simple terms, that if we stop or if we pause our training, what happens? Our brain has a good muscle memory, our muscle will have a good tension sensing capacity, and they will obviously conserve their efforts, conserve their fuels, and they will remodel to their original uh, sh- size or shape if the training ceases. So that's a short description for the uh, strength aspect. We'll take a short 10-second break and then we'll come back with a video discussion on another important topic. See you soon. നമ്മളത്തെ കഴിഞ്ഞ അവസ്ഥ ഇത് വോളിയം വാങ്ങിക്കണം. കഴിഞ്ഞ അവസ്ഥ കുറച്ചും കൂടെ വായിക്കണം. എനിക്ക് അത്ര തൃഷ്ടിയില്ല കഴിഞ്ഞ ഇംഗ്ലീഷിലാണ്. എനിക്ക് ഇതൊന്ന് കാണിച്ചാൽ മതി. ഇത് കാണിക്കുമ്പോൾ ഞാൻ അങ്ങോട്ട് നോക്കാം. കാണാൻ പറ്റുമോ? ഏഹ് എന്റെ പുറകിൽ നിന്ന് കാണിച്ചാൽ മതി. അതിൽ നിന്നല്ലേ? ഏഹ് അതിൻ്റെ അകത്ത് കാണാൻ പറ്റും. അത് ചെയ്തോളാം. എന്നാലും എനിക്കൊരു ഹിന്റ് തന്നാൽ. Hello everyone, welcome back. So we are just going to discuss briefly about the science of smart exercise. We know that the human body is a complex machinery. So many fundamental units work together. But have we ever wondered what's really happening when we exercise? We discussed about the motor unit recruitment pattern and other aspects, but these are just starting points there. So many units gets involved there. So it's not just exercise, but each exercise sends a specific signal to your body that helps the body to adapt, and the neuromuscular system becomes more active, which helps you in generating a better force. So if you are talking about the workout, body adaptation, getting stronger, faster, and being flexible is the answer. Today we are going to discuss about the grammar of muscle functioning. So if we need to speak the language of the body, we need to understand the grammar. Grammar is nothing but a structured training regimen. Strength is the foundation of any program, but it's just one aspect of it. There is strength, flexibility, endurance, multi-dimensional. We discussed about slow twitch and fast twitch muscle fibers. Type 1 is fatigue resistant, low force. Type 2, explosive, and they produce quick force. These dynamics are very important whenever we indulge in different types of functional activities or type of functional training. These training patterns greatly significance the way by which the muscle acts. The hypertrophy, as we said, 6 to 8 weeks, after 6 to 8 weeks, the muscle patterns or the muscle bulk becomes observable. So that aesthetic aspect starts appearing 6 to 8 weeks, and with a proper effect, we can have a taut body. The overload principle suggests that to increase muscle strength, we need to challenge it beyond its uh, present status. So, in an overload, a stimulus is being applied like a challenging a weight, the body gets adapted, means the muscles get stronger. And once the muscle gets stronger, we try to lift more weight, we challenge the nervous system. So we lift a little more heavier weight and the cycle is repeated. For muscle endurance, the repetitive range is 12 to 20 with a rest period of 20 to 30 seconds. Muscle growth 8 to 12 reps, 30 to 120 seconds. Maximum strength 1 to 8, 2 to 5 minutes. So imagine that if you're looking plainly for the strength aspect, you need to have adequate rest. So we talked about the grammar and what is the engine that fuels the body musculature, that is the endurance. Two aspects, muscular and cardiovascular. Muscular is the ability of the muscle to contract repeatedly for any activity, and cardiovascular endurance is the ability of the heart to withstand dynamic exercise over a long period of time. So it is often based on the Fitts principle, which dictates us the frequency, intensity, time, and type. How often, how hard, how long, and what activity. The answers for these are not clear cut, but as our age progresses, the percentage contribution of the fit changes and our preferences also change. A simple example is a talk test where a person is able to do a, a conversation while doing an exercise of moderate intensity without skipping a breath. So that doesn't mean that he'll be uh, doing that in a full flow, but he should not be skipping the breath. Third aspect is the mobility, which is the framework that we all miss. The entire lower kinematic chain and the upper kinematic chain and the spine functions on this framework of mobility. Without this mobility, an injury will become your best friend. So, dynamic flexibility and passive flexibility are two important aspects of it. Whenever you are doing an active range of movement, the dynamic flexibility aspect comes, and individual flexibility of your joint structures, muscles, tendons, elongation power that comes under the passive flexibility. Yeah. Okay. Let's see. We sincerely apologize, like how we have been discussing about the neuromuscular adaptation. I think the network issues are making us adapt to the classes. So I sincerely apologize. There have been two glitches where we had a challenging uh, experience from the network. So let's go on with the class. So we discussed about the talk test where if a person is able to do a exercising activity which is of moderate intensity but without skipping a breath. So every person can determine his own or her rate based on this simple aspect. So rather than pushing the patient into the deep discomfort zone, it's very important. So mobility is the key framework, and we discussed about the active and dynamic mobility. Active mobility is the mobility that your body system is having whenever you are performing any day-to-day range of movement activity. And passive flexibility, dynamic flexibility is the active range of movement that we are experiencing in our day-to-day life, while the passive flexibility determines how far a joint can be stretched. So it's the individual stretchability characteristics of our musculotendinous unit, basically. Ballistic stretching, this is not so preferred mode of stretching. It's a high intensity, short duration, bouncing mode of stretching activity. We generally don't prefer such stretching activity. And as we said, it's unsafe, poor control, and it has a potential for tissue rupture also, which we won't want if we are rehabilitating a patient after he has just recovered back from the initial injury status. We never want that thing to happen. So the ballistic stretching is unsafe. Stability. Stability is something that translates into ultimate results of strength training, endurance training, and your flexibility aspect. If along with that you are not incorporating the stability, it's gone. Without stability, you may not be having a good postural control, and your neuromuscular system may not be efficient to take your load whenever the body is challenged to new situations. So this neuromuscular control aspect is also very important here. Your core provides a stable base which helps in functional activities. And for a sports person who is involved in high intensity dynamic activities, this core is very important, which helps in explosive power. So the blueprint is the smart training principles that we need to incorporate in our day-to-day life, whether you are a sedentary individual, whether you are a working professional. Specificity, determine what's best for your body, what matches it. Reversibility, we know that the training gains, plateaus, or goes back to its original phase once the training stops for a significant period of time. It's most noticeable after 2 weeks. So your body is always adapting, and what are you wanting it to be? Select the best choice for your body. Thank you for your time. Going to take another short break. And once we are back, I would request all of you to have a pen and a paper, because we are going to have a 20 model MCQs for the uh, things that we have discussed till now. So it will help you in giving a better understanding regarding how much you have understood from the small discussion we had. So have your pen and papers nearby. And after the 20 model questions, when the answer keys are being discussed, you will get an idea how much is your success rate in that. Best wishes for that. Hmm? കുറച്ചും കൂടെ ഇത് പോയി 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 Okay. Hmm. ഇത് ക്രോസ് ചെയ്ത്. Okay. Welcome back. So this scenario, we always make sure that after every session, you get an exposure to minimum 30 to 60 questions. And our normal sessions are more exhaustive than the present session of say 1 hour. It spans to 2 hours. And whenever we need a focus care, it spans to 2.5, sometimes in very rare occasions. So I am going to give you a choice of 20 MCQs, and I hope it's clear on your screen. So to make it clear for you, I'll be standing slightly away from the main screen and I'll be reading the questions for you. There are four choices given. You have to select the best choice. And once I have read the question, I'll be giving a 10 seconds. And after that, I'll be moving on to the next question. Question number one. A physiotherapist is educating a student on the fundamental properties of muscle. Which of the following statements best defines muscle strength? A. The ability of muscle to contract repeatedly over time. B. The speed at which the muscle can shorten against a load. C. The total force output a contracting muscle can generate. B. The capacity of a muscle to stretch and return to its resting strength. So look into the uh, choices. Four choices are there. And then we'll be going to the next question. So four choices. You can see question number one. There are four choices, A, B, C, and D. So take a time and then think of the best possible answer based on what we have discussed. Okay, you go to the question number two. Okay, so to make it more visible to you, I'll just move back. A patient asks why their initial strength gains in the first 2 weeks of a new program have been so rapid, despite no visible increase in muscle size. The therapist's best explanation would be your muscles are experiencing hypertrophy, which is the first adaptation to training. B. Your body is converting slow twitch fibers into fast twitch fibers to meet demand. C. The gains are primarily due to improved motor unit recruitment and synchronization by your nervous system. D. The result of an increase in number of muscle fibers, a process known as hyperplasia. So remember, despite no visible increase in muscle size, the strength gains have been rapid. So what would be the best explanation? The trick lies here is the best explanation. So look into the four choices and then go for the best choice. Question number two, A, B, C, D. Look into that. So you can see question number two. Our technical team has zoomed it for you so that you guys can have a closer look. Okay, go to the question number three. During a maximum effort bicep curl, a client is able to lift the most weight through the middle of the range of motion, but struggles at the beginning and end of the lift. The phenomenon is best explained by option A, the overload principle, option B, the length tension relationship, C, the principle of specificity, D, reversibility principle. And this should be easy for you, provided you had listened to the discussion carefully. So take your time. Our technical team will zoom into that aspect. Question number 3, A, B, C, D. Select the best choice. We are going to question number 4. I hope you all are having your notepads. You are writing down the options you have selected so that it becomes easy for you once we discuss the answers. So you can uh, check yourself how much percentage you have got or where your level of understanding is, which point you need to work upon. Question number 4. A physical therapist is designing an exercise program for a marathon runner aiming to improve endurance. The training should primarily target which muscle group? Type 1, slow twitch. Type 2A, fast twitch. Type 2B, fast twitch. D, a combination of type 2A and type 2B. Select the best choice. The training should primarily target which type of muscle fiber? Okay, going to question number 5. According to the principle of recruitment order, if an individual performs a squat, progressing from standing up out of a chair to 1 repetition max, the muscle fibers would be recruited in which order? See, whenever we have created this model for you, it has been prompted in such a way that there's a mixture of questions. Some of them are very easy, some of them are application type, some of them are tough. And this sort of a question is exactly what you can see or what you can expect in your real clinical scenario examination pattern. Because this is a perfect example of a damner mode of question where it just speaks about the recruitment order, but in between that, so many things are being filled to divert your attention. Performs a squat, standing up from the chair, 1 repetition max. It all ends up in the muscle fibers will be recruited in which order. So you should be skilled enough to tackle such stuff and to save your time. Okay, I'll just go to the choices. A, B, C, D, fast twitch 2B, 2A, short twitch. B, fast twitch 2A, short twitch. Fast twitch 2B, short twitch muscle is otherwise called as type 1 muscle fiber. So don't get confused. We told that type 1A muscle fiber is always called as short twitch or a slow twitch muscle fiber. C, slow twitch, fast twitch 2B, fast twitch 2A, D, slow twitch, fast twitch 2A, fast twitch 2B. So try looking for the best answer. So our technical team will just zoom it for you so that you can just look into it and try to reach out to the best possible choice. Okay, we'll go to question number 6. A patient is immobilized in a cast for 6 weeks following a fracture. Upon cast removal, the therapist notes significant weakness and reduction in muscle girth. This is a direct result of A, disuse atrophy, B, muscle remodeling, C, hypertrophy, D, detraining due to poor genetics. So select the best choice. Our team will zoom it for you. So you can select the best choice from that direction. Question number 6, A, B, C, and D. Going to question number 7. Which of the following represents the most basic contractile unit of muscle where the sliding of actin myosin fibers occurs? Most basic contractile unit of a muscle. A. Muscle fiber. B. Myofibril. C. Sarcomere. D. Myosin cross bridge. It is not myosin cross bridge, it is actin myosin cross bridge to be precise. So select the best answer A, B, C, and D. Our team will slightly zoom it for you so that it is easy for you to detect it. So go for your best choice. Okay, we are going towards question number 8. A client has been consistently strength training for 10 weeks. What structural changes is mostly likely responsible for the visible increase in the muscle size? A. Increased synchronization of motor units. B. Hypertrophy due to an increased actin myosin filaments. A genetically determined increase in fast twitch fibers. And D. Enhanced elasticity of sarcomeres. Our team will just zoom it for you so that you can select the best choice A, B, C, and D. Okay, going to question number 9. A weightlifter performing a near maximal deadlift experiences a temporary blockage of blood flow to the working muscle. This workout is considered to have an high aerobic focus, primary cardiovascular benefit, anaerobic focus, high fatigue resistance demand. This sort of a question requires slightly high level of associative thinking. So just write down what is your best possible choice here, and when the answer key discussion is there, you can find out what is the best answer possible in this. Actually, there are, in my mind, multiple answers are conflicting for the top sport, but on the skill here is to come to a conclusion based on the best possible outcome in a clinical outcome viewpoint. Going towards question number 10. A physical therapist designs a rehabilitation program for patient recovering from knee injury that involves exercises mimicking climbing stairs to help the patient return to that specific activity. This program design is a direct application of which principle? Again, this is a classic example of a dampener and distractor question. There are so many distractors. Basically, the question wants to convey what is the type of exercise training principle adopted in it. So select your answer, select your choice very carefully. Type, sorry, A, the overload principle, B, reversibility principle, C, specificity principle, D, length tension relationship. Our team will just zoom it for you, and I will just zoom down to show you the answer D. Have you seen the option D? This is the option D, and these are options A, B, and C. Okay, we go to question number 11. Which characteristics is unique to type 2B muscle fiber when compared to type 1? Type 2B. You know that in 2 there are many classifications. We are talking specifically about 2B. 1, high fatigue resistance. B, slow contraction speed. C, high force production. D, primary use in endurance activity. So if you know specifically what these muscles are meant for, the answer is a cake mark for you. So our team will slightly zoom the choices for you, A, B, C, and D. Please select the best choice. Okay, we are going to question number 12. A patient consistently lifts the same weight for same number of repetitions for several months and reports that they are no longer getting stronger. To continue making strength gains, the therapist should recommend an adjustment based on the A. Overload principle, B. Specificity principle, C. Principle of reversibility, D. The concept of disuse atrophy. So our team will zoom it for you. Select the best choice possible in this. Overload, specificity, principle of reversibility, concept of disuse atrophy. Okay, we'll go to question number 13. In the context of length tension relationship, the weakest point in the range of motion is significant because it A. determines the point of maximal force generation. B. is the primary area where muscle hypertrophy occurs. C. limits the total amount of weight that can be lifted through the full range. D. indicates the resting length of sarcomeres. Again, a very tricky question where multiple answers are conflicting and competing for the top spot. Select your best choice. A, B, C, and D. So question number 13. So our team will zoom it for you. In context of length tension relationship, the weakest point. Okay, going towards question number 14. A middle-aged patient begins strength training program to manage their health. Beyond improvements in strength, which set of positive changes in impairments can the therapist recently expect? A, B, C, D. A, decreased bone mass and increased blood pressure. B, increased fat mass and slower reaction time. C, improved bone mass and decreased blood pressure. D, reduced immune function and poor weight control. This should be a straightforward answer for you all. So select the best possible choice from question number 14. Okay, we're going towards question number 15. A client with limited time wants a workout that improves muscle strength and cardiovascular health simultaneously. Which training should be most appropriate? High resistance, low repetition training. A. B. Low intensity, long duration aerobic exercise. C. Circuit training. D. Flexibility and stretching routines. This is also a slightly advanced level clinical judgment sort of question. So our team will zoom it for you. Select the best possible option from this A, B, C, and D. Coming to question number 16. The sliding filament theory of muscle contraction describes the interaction between which two proteins? Sarcomeres and myofibrils, option A. B. Actin and myosin. C. Type 1 and type 2A muscle fibers. D. Tendons and ligaments. So, sliding filament theory, our team will zoom it for you. A, B, C, and D. Sliding filament theory. This should be a cakewalk. Coming to question number 17. An elite Olympic sprinter. The key is an elite Olympic who sprinter. would likely have a genetically high proportion of which muscle fiber type to allow for explosive high force movements? A. Type 1 muscle fiber. B. Slow twitch muscle fiber. C. Fast twitch 2B muscle fiber. D. Slow twitch muscle fiber. Our team will zoom it for you. So if you have read the question carefully and the emphasis that I have put on all my wordings, I believe strongly that you may be able to come to the answer within no time. Okay, we are going for question number 18. The principle of reversibility is best demonstrated by which of the following scenarios? A person increasing their bench press strength from 150 lbs to 180 lbs over 8 weeks. B. A runner who stops training for a month and finds their cardiovascular endurance has decreased. C. An individual focusing on leg exercises to specifically improve their squatting ability. D. A patient feeling their muscles are strongest in the middle of a movement. Principle of reversibility, straightforward option. Our team will zoom it for you. A, B, C, and D. Select the best possible choice. Okay, coming to question number 19. Muscle remodeling in response to strength training involves a quantitative increase in all of the following except the number of actin and myosin filament, the number of myofibrils, the number of sarcomeres, the number of muscle fibers. This is also a very, very challenging question. If you are, it needs a slightly higher level of clinical reasoning also. Quantitative increase except question number 20. A patient with osteoporosis is referred for physiotherapy. The therapist includes resistance training in their plan of action. The primary rationale for this intervention is that strength leads to improved reaction time and coordination, enhanced self-image and posture, increased bone mass and density, decreased body fat percentage. A, B, C, D. Here also, these sort of questions sometimes even challenge the experienced clinicians because this all needs to be approached as a case-to-case basis, and sometimes you need to enter up thinking that may guide towards the best answer. So the key links here is osteoporosis, strength training, rationale. So think of osteoporosis, what all things can happen, what all would be the problems, and how you can associate it with this. Okay, so I hope all your notepad is on now. We are just going to discuss the answer keys and then you can cross check. So question number 1, the answer is C. Total force output. Question number 2, C. The gains are primarily due to improved motor unit recruitment and synchronization. So if I remember correctly, in the first few weeks, we may not observe hypertrophy. 6 to 8 weeks, after 6 to 8 weeks, only hypertrophy element comes into. 3B, length tension relationship. At the mid-range, we have got a maximum tension producing capacity, and the difficulty at the beginning and the end of the lift corresponds to point where there is lower force production. Type 4, slow twitch 4, option is A. 5, slow twitch, fast twitch 2A, fast twitch 2B. 6 answer is disuse atrophy. A. 7 sarcomere. 8 actin myosin fibers. Option B. 9 high resistant exercise is mainly of anaerobic force focus. 9C. 10 C specificity principle, where we are teaching the stair climbing. 11 high force production type. The guide contrasts type 1 with type 2. Type 1 is low force, type 2 be high force production, high fatigue. 12 is A overload principle. 13 C that limits the total amount of weight that can be lifted through the full range. 14 C improved bone mass and decreased blood pressure. 15 circuit training. See, a person simultaneously wants the benefit of strength training and cardiovascular aspect, then the circuit training is the correct answer. But be aware of the fact that now challenges are there, literature are there which suggests whether circuit training is as effective as it has been claimed few years back, or whether we should go for the specific training approach. It's always based on individual choices and the work schedule that a person is having. 16 choice is B, actin myosin. 17 C, fast twitch 2B, high explosive, high force. 18 B, principle of reversibility. 19 number of muscle fibers. Okay, so what we have to understand is that whenever the muscle fibers, whenever we are seeing increase in muscle fibers, it's not actually the muscle fibers but the individual components of the muscle fibers that are increasing. So the increase in the number of fibers is called hyperplasia, which is not the primary mechanism of muscle growth in humans from strength training. So that is 19D. And 20C with osteoporosis, increase the bone mass and density is the correct choice. So in this, some sort of a questions even challenged me, 1 or 2 questions when I was not sure of the correct answer, but that's the way exams works. It challenges the best experienced people also, and that should be the way it has to be. Otherwise, we will all be stagnant in our learning. So from side of Bemax Academy, uh, it's a big thanks from all our side. I know that this session has stretched for so long. It has been a lengthy session. We have been reaching to a span of 1 hour. Thank you all for your time. Hopefully, we'll meet again coming week. Have a good day. Bye, everyone. Thank you. Thank you. Cheers.